We have the case of a young patient, headache,
Yep.
seizures, vocal neurodeficits. What the heck? And the
I
classic
know.
story, young
Young
female
female.
postpartum with lethargy and headache. Oh my
Hmm.
gosh, there's only one answer for this on the test.
Only one.
Only
And they might
one.
ask you, in the way that they'll try to ask you this one too, is it's oftentimes like,
And they
what
had a negative
imaging
CT head.
modality? Yeah, yeah, negative
Negative
CTED.
CT head. Yeah.
Or they'll try to trip you up and they'll say, what imaging modality will essentially find your
Hmm.
diagnosis,
That's
right?
good. I like
So,
that. Yeah.
because they'll assume kind of next step. They won't say that like CT non, and that's
No.
reasonable to get like a CT non-com, but they'll try to trip you up by basically saying, "Hey, what imaging modality will actually
Yep.
diagnose this in the ED setting, right?
Yes.
And what is that going to be?"
This is a cerebral
Mm,
sinus
mm,
venous thrombosis. There's like three
right,
different ways to call this thing. There's like three different names to it. The way I think
yeah,
of it though is a DVT for the brain. Same risk
yep,
factors. Young females are usually more predisposed to this than young
yeah,
men, but it is young people. So think over, birth control pills, cancer
yeah,
history, thrombophilia in general. The diagnosis here to get this
yeah,
right is usually a CT venogram because that's what you have readily access to. It's like
available,
90% specific, whatever that might be one of the answer choices. Or the other answer choice, the more accurate answer choice, is an MRI with venogram. So an
right,
MRV or MRA sometimes too.
right,
The plain CT, like we just said, is often normal.
right,
And so anyway, on the test, they're never going to give you both those options. They're going to just give you one or the other, the CT
yeah.
venogram or the MR venogram. That's the diagnosis. What's the treatment?
So treatment here is going to be heparin,
Yep.
even even with hemorrhagic
Yeah,
infarcts,
that's
but
that's
it's
the
going to
weird
be
part. But yeah.
it's gonna be heparin.
Hmm.
This is also one of those where they might give you in that stem this patient was just evaluated in the ER because this is oftentimes a diagnosis you're
Absolutely
making
missed.
on the
Yeah.
second visit, right?
Yep.
So for a clinical kind of stem that you'll see, also oral boards. This is a good one to kind of review and do. Is that patient was already seen, already had like a negative CT, and now they're back. And oftentimes, again, they're going to give those risk factors. They have to, which is like postpartum, OCP use, or some sort of prothrombotic state. That will definitely be mentioned in that stem. And again, you should be pushing for some sort of venous imaging here.
For sure.
And these patients are oftentimes having seizures, focal neurodeficits. The thing is, though, once they're having seizures, focal neurodeficits, the CT non-con oftentimes does show what the diagnosis is. But again, remember that in the stem, it's going to be one that was a patient that was already sent home, or it's going to be one with some of those key risk factors that we mentioned.